Now for more on these blistering temps just taking a tremendous toll on people's health. We're going to go to the chief clinical officer there at that same facility of Valleywise Health in Phoenix, Dr. Michael White. And we thank you, doctor, just for helping Mola tell us this story and just giving us access there and now being able to talk to you on just the types of conditions that you have been seeing every single day. Describe to us what you're witnessing for the first time.
You know, certainly as we've seen the temperatures rise here throughout the state of Arizona and, again, throughout the southwest of the United States, we're starting to see those individuals with other medical problems and even those that are healthy that are exposed to these extreme temperatures come in with a variety of conditions. A lot of folks are coming in with heat exhaustion. Their temperature rises, their body's unable to regulate and help cool itself down after being exposed to these particularly high temperatures, which can progress even worse into heat stroke, in which the body just begins to literally shut down on its systems. It just cannot accompany and equilibrate from all of this heat. And again, if those folks that have other medical conditions as well, they start to exacerbate those and make those conditions worse. And, worse here, especially in Arizona, is if people were to suffer some sort of event outside and they were to, for some reason, fall or pass out, the ground is so hot that they'll begin to get burns on any exposed skin as well. So we're dealing with all of these constellation of problems, that are related to the heat.
So Mola showed us there in his report, he actually demonstrated one of the treatments you've been doing, that ice bath that we saw. What other treatments have you been using for hypothermia?
So for the hyperthermia, again, you're seeing that, that we're able to put patients in ice around this. We'll start IVs to be able to give cooler fluid as well, directly into the body through IVs to help with this. And, in some extreme conditions, again, start to begin to things to be able to treat the burns that people may be suffering as well. So those are our big things. The big thing is to get people out of that heat source and into areas that are cooler so the body begins to equilibrate on its own.
So a lot of people don't see it coming on, right? They may feel that something's not quite right, but it can hit them quickly and hit them fast. Do you have any sort of advice, warning signs that people should pay attention to before it gets to the point where they end up in your clinic?
Absolutely. As people have to go outside in this extreme heat, it's really to minimize the time that's in that direct sunlight. Certainly, if you're out in there, make sure that if you're able to keep your head, and your body covered to minimize that exposure to that. It's being able to drink, a lot of fluid, and you need more fluid in this type of heat than you realize. Your body is sweating, that sweat is evaporating, and you're losing a lot of that moisture. So it's making sure that you're staying hydrated and drinking a lot of fluid. But as these temperatures rise to these levels, it's really minimizing that time where you're exposed to the heat to as short as possible, especially in the times of the day where it's the hottest, in those early afternoon, and late afternoon times, especially here in Arizona.
Dr. Michael White, thanks for just joining us. I know you're a busy man, so we appreciate this. Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.